So, sitting here with my dog. I thought I'd post a little update. My name is Michelle, and I am documenting my journey fighting metastatic triple negative breast cancer. And this is week number 20 of chemo. So, after my last update, which was 2 weeks ago, I wasn't sure if we were going to continue with chemo or with Keytruda. Because Keytruda has shut down my adrenal function. So we did stop Keytruda. That is on hold for now, according to my oncologist, but we're not continuing with Keytruda. But we did do chemotherapy that week, and we did it this week as well. This week is the 20th week of chemo, and it was my graduation. So I will insert that video here of my very last leaving chemo for the last time. So that's what it's like when you graduate chemo. You get to ring the bell, and all the nurses, well, that's not all the nurses, but that's a handful of the nurses that are there to kind of send you off. Although I'll be back tomorrow for fluids. So here's what we did last cycle, which we're continuing this cycle. I had a bolus of fluids with chemo. So along with the pre-medication, we did 1,000 milliliters or 1 liter of fluids, just saline with the chemotherapy. And we also cut the adriamycin and Cytoxan chemo by 20%. So we did a lower dose of chemotherapy. In addition to that, I increased the steroids that I was taking at home. So because I'm not making my own cortisol, I have to supplement a little bit higher than maybe most people do, or actually it's a little bit longer than what most people do. So I get 6 milligrams of dexamethasone pre-medication along with the Aloxi and the Amend pre-meds, 20% reduction in the adriamycin and Cytoxan, and the bolus of fluids at chemotherapy. Then on days 2, 3, and 4 of my cycle, I take 4 milligrams of dexamethasone orally at home. And then days 5 and 6, we took last time, we did 2 milligrams of dexamethasone in the morning, 6 in the morning. And then I went back to what I had been doing prior to that, which was 20 milligrams of hydrocortisone at 6 a.m. and 10 milligrams of hydrocortisone at 2 p.m. to mimic the natural kind of circadian rhythm of what my body should be producing. Our plan this time is to do the same thing. Basically, they're telling me to do it depending on how I feel as far as tapering down. And I'm not really sleeping well on that high level of steroids. So we'll see if I do that. Look, I've lost more of my eyebrows, and almost all the eyelashes on this eye are gone now. But I'm done with chemo, so those will start to grow back soon. This one, I scratched it there. And then the plan is to go down to a more maintenance normal dose for a normal person who's not being constantly stressed with chemo. So we didn't have time to do that on a 2-week cycle, but we have 4 weeks now until my first surgery. So the plan is to go down to 20 milligrams of hydrocortisone in the morning and only 5 at night, or maybe it's 10 and 5. I have to double check the notes. And that would be more what your average person might, who's not under any kind of duress, would produce in their own body. So that's the goal. And then my surgery is going to be on January 30th, my first surgery. There will be 2 surgeries, which I found out yesterday. Yesterday I met with the cardiologist, which I am actually increasing the beta blocker again because he didn't really feel like I needed to reduce it. They reduced it in the hospital, but it was the adrenal function that was causing my low blood pressure, not the beta blocker. And my blood pressure actually was more normal on the beta blocker. So we are going back up to 50 of the metoprolol to see if my heart function, gets better or worse, or if I feel better or worse or whatever. So playing with that. And then surgery. I met with the plastic surgeon yesterday, and I meet with the breast surgeon, the breast oncologist, surgical oncologist, on the 8th. But I spoke with her today as well. So the goal is to first do surgery on the breast that had cancer in it. The MRI showed that the tumor is gone, but they still have to take out that tissue surrounding the biopsy clip. And so the plan is to do the left breast first, because that's the one that had cancer in it, and also the lymph nodes there around the biopsy clip are still enlarged. So those are coming out. They're going to check them while I'm there. If there is any evidence of cancer, they will take the rest of the lymph nodes out. But they don't anticipate that, so they're hoping just those 2 lymph nodes that were affected will be removed, and then the tissue around the biopsy clips will be removed, and then the plastic surgeon will put that breast back together smaller. After surgery, I will have radiation on that breast, which will continue to change the shape of that breast. So the plastic surgeon does not do them both at the same time, because then after radiation, they would not match. So the whole goal of having plastic surgery and a breast reduction is to do it so that I come out, on the other end matching. So I will have surgery on the 30th. I will then have radiation about 4 weeks after surgery. I'll have 5 or 6 weeks of radiation, and then I will go in for the second breast reduction on the other side so that they match. And that's it. That's pretty much my update. We had a good Christmas. Everyone else in my family was sick, so we didn't get together with relatives like we normally do. It was just, my son is home from college, and just the 4 of us here, my son, my daughter, and my husband and I. And we had a nice, quiet Christmas. It was not as many gifts as we normally do, but we had nice time together. So, and my son is still home for another 3 weeks or so that's good. But that's the update. So I'm done with chemo. All done. No more. I have a follow-up with the oncologist on the same day I meet with the surgeon on the 8th. And so we'll see what he says as far as what plans going forward there are from a chemotherapy or immunotherapy or any of that. I don't anticipate much to report there. I know that there was originally a plan for some sort of maintenance through the next year or 6 months or something, but I don't remember. So we'll see what they say then. But as of now, no more IV chemo. Done with that. My hair can start to grow back now. And that's it. Have a wonderful continuation of the holiday season, and a Happy New Year, everybody.